the others. Could we go on to Lindsey Martindale?
Hi, yes, good morning. Yes, good morning. My name's Lindsey Martindale and I'm the Safeguarding and Wellbeing Lead at Funeral Experts. We provide a free, independent and compassionate practical and emotional advice service to individuals and their families at the end of life and beyond. And we've been actively supporting patients and families for around the last 12 months, working alongside NHS Trusts, local authorities, community services and charitable organisations. I want to highlight our three concerns that we've drawn on from what we hear every day from families and our colleagues. So number one is that non-clinical support is often overlooked. So when someone's dying, families are often hit by a wave of practical worries. So the likes of what happens to our home, can we afford their funeral, how will our children cope? But what we find is that these worries often go unspoken. So people can feel a range of emotions associated with their worries. They may even feel guilty or think that raising them with clinical teams at that time is inappropriate. When the truth is that these aren't after problems, they are part and a key part of the end of life journey. And what we find is that early practical and emotional support can really reduce that stress, prevent death, and help people to be much more present in their final moments together. So number two is that families often don't get the support early enough to explore their wishes and options, which I think has been mentioned a few times this morning. And without that, what we find is that many families will go straight to the likes of a funeral director, very often under emotional duress and unaware that they even have choices in that situation. And some will feel rushed into costly decisions that don't reflect their values and budget, and that can leave them in debt and ultimately exacerbate their emotional strain. What we try to do is to create a safe space for people to ask questions and understand what is possible and what is available. And we help them to make clear, confident and informed decisions with a peace of mind. And number three is that bias and referral hesitancy is still getting in the way, unfortunately. So what we find is that some professionals are still defaulting to a single funeral provider, or they're relying on outdated resources and materials despite the CMA order. So unfortunately, free independent support can often be overlooked or blocked, which limits the choice and adds pressure at the worst possible time for families. We genuinely feel that referrals should be based on need and not habit or hesitation. So drawing on all of those, our three priorities are quite simple, really, in that early access to independent support should absolutely be the norm for families. That professionals need to feel confident in referring to support services and understand their importance. And that non-clinical support must be embedded nationally. From working with families over the last 12 months, we know that our service is unique and that we provide a very much needed support to families, and we genuinely feel that funeral experts could really play a valuable part in that wider support system for end-of-life patients and families. So we'd love the chance to work more closely with the Commission and help change, shape change for people. And we'd be more than happy to provide, a briefing on the full range of services. I know we haven't got that time this morning, but we'd be more than happy to provide that as well. So thank you for the opportunity to address those things today.
Lindsey, thank you very much indeed for bringing in that completely different concept, which is really important. So let's